What is acute pancreatitis? So in this new series, 10 Questions with a Surgeon, I'm trying to get at anybody interested in a particular surgical topic, and today we're talking about acute pancreatitis. I'm going to go through the causes, how we define it, how we diagnose it, how we treat it. Towards the end, we're going to talk about how we can recover from it, any lifestyle modifications and complications associated with acute pancreatitis. So if you're a curious person, you don't have to be a surgeon, a medical student, a resident to want to know more about the human body. That's the point of this series. Let's get into it. 10 Questions with a Surgeon, acute pancreatitis. Let's go. Welcome back to Citizen Surgeon. My name's Dr. Eric Pearson. I'm a pediatric surgeon. I love scaling surgical education, and in this series, 10 Questions with a Surgeon, I look at different surgical topics and I go through what I think are the 10 most important questions to ask. So today we're doing acute pancreatitis. This is a common thing that we see in the emergency room and on surgical services, and it's one of these things where you can have mild forms, you can have severe forms, and most importantly, there are lifestyle modifications that we can make that can help us avoid pancreatitis in the first place. So what is the first question we can answer? Well, that is, what is acute pancreatitis? Well, anything with itis means inflammation. So that's a nice generalism in surgery and medicine. Okay, so acute pancreatitis means inflammation of the pancreas over a short period of time. So hours to days, okay? Chronic pancreatitis is inflammation of the pancreas over months to years, okay? And so that's a little different entity that we could talk about in a different setting. But here, this is going to be acute pancreatitis, so inflammation of the pancreas over hours to days. So how long have we known about acute pancreatitis? Well, we've known about pancreatitis for a long time. So in the mid-1600s, a Dutch anatomist first described inflammation of the pancreas. But it wasn't until the late 1800s, early 1900s that we really started to get some momentum in understanding this problem. In 1901, a pathologist by the name of Eugene Opie was the first one to really start to elucidate the pathophysiology of this disease. In the 1940s, we identified the association between alcohol and pancreatitis. In the 1960s, we developed the labs to evaluate amylase and lipase as markers of pancreatitis and help us make that diagnosis. Later on in the 1980s, we developed ERCP, so endoscopic retrograde cholangiopancreatography. That allowed us to extract gallstones from the common bile duct, which is a very common cause of acute pancreatitis. And even more recently, we've really developed a solid understanding of the inflammatory cascades that lead to severe pancreatitis, and we've developed protocols and methods in how to treat this and avoid devastating complications. So what is acute pancreatitis? Acute pancreatitis is inflammation of the pancreas, which is that organ that lies in the retroperitoneum, the very back of the abdomen, and it gives a very characteristic set of symptoms, signs, of course, lab tests and imaging findings, which we're going to talk about in the next few questions. So what is the second question we want to ask? Well, if we're going to ask, well, what it is, we want to know, well, how common is this? Is this something I need to be worried about? Well, acute pancreatitis is pretty common. And in medicine, we use the word incidence to describe the number of new cases per year, per population. Okay, so for example, in acute pancreatitis, we're going to see between 15 and 45 new cases per 100,000 population per year. Well, that might not sound like a lot, but if we look at the United States, we're going to see about 275,000 cases of acute pancreatitis every year, and that's going to be at a cost of $2 billion. So that is a pretty common problem. Now, What makes it even worse is the mortality associated with acute pancreatitis is pretty high. So between 2% for mild pancreatitis up to 25% for severe or critical pancreatitis. And we're going to talk about what that means a little bit later. When we think about how common it is, we have to pay attention to demographics. So it's more common with increasing age. So the 50 and 60-year-old patients, that's where we see the peak incidence of pancreatitis. It's more common in males than females. It's more common in North America and Europe than other parts of the world. So acute pancreatitis is a common problem. It is a very expensive problem, and it carries with it significant morbidity and mortality. So let's get into that next question. So we know what it is. We know how common it is. Well, what causes acute pancreatitis? When we look at the two most common causes of acute pancreatitis, they are gallstones and alcohol. And those two account for about 70% of all of the cases of acute pancreatitis. But there are less common causes, okay? And one of the things we do in medicine to remember long lists of things is acronyms. We use acronyms. And so a good acronym to remember all of the causes of acute pancreatitis is I get smashed, okay? Well, what does that stand for? Well, the I is idiopathic. That means we don't know what caused it. G is for gallstones. E is for ethanol or alcohol, okay? And then T is for trauma. So blunt abdominal trauma or even penetrating trauma to the abdomen can cause pancreatitis. S is for scorpions, okay? So there are some scorpions whose venom can cause acute pancreatitis. M is for mumps. So viral illnesses can cause pancreatitis. A is for autoimmune, so autoimmune pancreatitis. S is for steroids, so corticosteroids. They can thicken secretions and lead to acute pancreatitis. That can help cause acute pancreatitis. H is for hyperlipidemia or hypercalcemia. Those are causes of pancreatitis. E is for ERCP or endoscopic retrograde cholangiopancreatography. So if we instrument the main pancreatic duct, we can risk causing acute pancreatitis. And then D is for drugs. So there are some drugs, for example, azathioprine is one kind of drug that always shows up in the exams, so that can cause acute pancreatitis. But there are a lot of causes. The two most important causes are gallstones and alcohol. All right, so now that we know what it is, how common it is, what can cause it, what are the symptoms of acute pancreatitis? So whenever I talk about symptoms of disease, I want to use this disclaimer. If you think you have acute pancreatitis, you need to talk to your healthcare professional, your doctor, or even the ER if you're really worried about it. But here are some symptoms. So the most common symptom patients present with is acute abdominal pain, okay? So I have a way that I ask about abdominal pain. I use 10 questions. I use another acronym, and that's SRN-OPD SARA. I go through that in a taking history video I've put out before, but that stands for site, radiation, nature, onset, periodicity, duration, severity, aggravating, relieving, and associated symptoms. So in pancreatitis, it's typically an epigastric pain that is radiating to the back. It's crampy in nature. It started within the last hour. It's usually rapidly progressive. It's constant with no periodicity. It is very severe pain, especially as it starts to evolve. It's aggravated by pressure, sometimes aggravated by movement or even eating. It's relieved with rest, lying still, or sometimes not relieved at all. And commonly it's associated with nausea and vomiting, sometimes an increased heart rate, sometimes difficulty breathing, and sometimes fever if indeed we have infected acute pancreatitis. All right, so those are just some of the symptoms. If we look at signs, so signs are what objectively do we see in a patient, whereas symptoms are subjective, so what a patient tells us. Signs of acute pancreatitis would be abnormal vital signs, so an increased heart rate, an increased respiratory rate, a fever if it could be infected, or if there's significant inflammation. We could have low blood pressure. When we looked at the rest of the exam, we might see that we have a distended abdomen. Maybe that patient has an ileus or paralyzed bowel because of all that inflammation. They could have abdominal tenderness, and there are some specific signs that we see in acute pancreatitis, like Gray-Turner sign. That's when we have bruising along the flanks, or Cullen sign when we have bruising around the umbilicus, and that's due to retroperitoneal hemorrhage or bleeding in the retroperitoneum that is found in very severe acute pancreatitis. So that's a look at some of the symptoms and signs. So now that we know that, we can get to the next question, and that is, how do we diagnose acute pancreatitis? Well, in medicine, the way we diagnose things is through a thorough history, a focused physical exam, and then the help of added things like lab tests or imaging modalities. Now, in pancreatitis, that history of epigastric pain radiating to the back, perhaps with some risk factor, perhaps alcohol use, a history of gallstones, a history of trauma, or any of those other causes in that Get Smashed acronym, will help kind of lead us to a diagnosis of acute pancreatitis. The physical exam, if we have epigastric tenderness, abdominal distension, perhaps we have a patient with jaundice from biliary obstruction due to gallstones that are now causing acute pancreatitis. We look at those things in the physical exam. And then labs. So there are a few specific labs that we use to make the diagnosis, and that would be amylase and lipase. Now, in the recent video I put out, Diagnosing Acute Pancreatitis, I talked about how lipase can be a very good lab, even better than amylase in making the diagnosis, and that's for a number of different reasons. But we would use an amylase or lipase level greater than 3 times the upper limit of normal, in addition to a history and physical exam consistent with pancreatitis, or imaging findings of acute pancreatitis. So for example, a CT scan showing an edematous pancreas with surrounding inflammatory fat stranding and edema. If we had those things, then we could say this is acute pancreatitis. Now, to make the diagnosis, you need 2 out of 3 things. So you could have a history and physical exam with labs, or history physical exam with imaging, or labs plus imaging. Any of 2 out of those 3 things will lead us to a diagnosis of acute pancreatitis. So the next thing to talk about is looking at, well, if we know what causes it and we know how to diagnose it, how could somebody decrease their risk of getting acute pancreatitis? I already mentioned that acute pancreatitis has a pretty significant mortality risk, between 2 and 25%. So if we can make some lifestyle changes to avoid it, well, all the better, right? So how can we do this? Well, first is look at the causes. So if gallstones and alcohol are the most common causes of acute pancreatitis, we need to decrease our risk of getting gallstones first, okay? Well, how do we do that? Well, we have a healthy weight, okay? Obesity is a risk factor for getting acute pancreatitis. We have to have a healthy diet, so low in saturated fats, low in cholesterol, balanced with lean meats, healthy vegetables, so we can decrease our circulating cholesterol and decrease our risk of getting gallstones. We can limit our alcohol use. We know that alcohol, especially in increased consumption of alcohol, can lead to acute pancreatitis. We also want to avoid smoking. So smoking causes significant inflammation throughout the body. It causes microvascular damage, and microvascular damage leads to ischemia, and that can lead to inflammation in the pancreas. We want to manage stress. So increased stress, increased circulating stress hormones like cortisol can lead to acute pancreatitis. We also want to manage any chronic conditions. So if we have chronic conditions like heart disease, lung disease, renal disease, metabolic disease like diabetes, we want to make sure that these are all optimized. And then finally, having regular checkups with our healthcare professional, with our family practice doc, can help us avoid having increased risk of getting acute pancreatitis or other medical problems. So those are just a few ideas on how somebody could decrease their risk of getting acute pancreatitis. All right, now we want to transition and look at, well, how do we treat acute pancreatitis. So when we look at treating acute pancreatitis, immediately I want to tell you that the treatment depends on its severity. So in mild acute pancreatitis, okay, and there's a way to define that, so no organ failure, no evidence of pancreatic necrosis. If we see that, then it can be treated with intravenous hydration, pain control, and a low-fat diet. As the severity of pancreatitis increases, the treatment becomes a little bit more intensive. In more severe forms, the patient may need treatment in the ICU. We may have associated conditions with pancreatitis like acute respiratory distress syndrome, arrhythmias, renal failure, perhaps a pancreatic abscess or a fluid collection, gallstones that need to be extracted with ERCP. So the treatment depends on the severity, but how do we initiate treatment? So the treatment of pancreatitis begins with IV fluid resuscitation and pain control, and then depending on the severity, it may include procedures, it may include surgery, it may include antibiotics if we have infected pancreatic necrosis. There's a range of things that may need to happen depending on how severe this problem is. So the next thing to consider is, what are the complications of acute pancreatitis? When I think about complications, whether it's acute pancreatitis or appendicitis or anything in surgery, I think of short-term complications and long-term complications. So the short-term complications are what I was getting at a little bit earlier. So if we have really severe pancreatitis, we may have acute renal failure, we may have cardiac arrhythmias, we may have acute respiratory distress syndrome, we might have pancreatic necrosis, so part of that pancreas dies. And if we have necrotic pancreas, perhaps we can get that infected, so we might get a pancreatic abscess. So there are a lot of these short-term complications. Well, what are some of the long-term complications? Well, we can have a pancreatic pseudocyst, so that acute fluid collection, if it forms a capsule, we can get a cyst within the pancreas. Many times those will go away on their own, but sometimes we need to do a procedure or a surgical intervention to drain that. We can get pancreatic atrophy, and if we get recurrent acute pancreatitis, that can increase our risk of getting a pancreatic cancer later in life. So a lot of different complications related to acute pancreatitis. I like to think about them as short-term, so related to the initial illness, or long-term complications that can happen later in the recovery process. So the next question to get at is, how do patients recover from acute pancreatitis? Well, whenever we're talking about recovery from any sort of medical problem, we want to always be following the advice of our healthcare professional, of our doctor, any instructions or education given, okay? But in general, recovering from pancreatitis means, number one, is a healthy, balanced diet. Usually we'll have a diet that's low in fat, low in fiber, to avoid stimulating the pancreas. We want to avoid alcohol. Alcohol is a toxin. Perhaps it caused acute pancreatitis in the first place, and we want to abstain from alcohol as our pancreas is healing. We want to avoid smoking or quit smoking altogether. Smoking, again, causes vasoconstriction, microvascular damage, ischemia in the pancreas, and that can impede the healing process. We want to make sure that we're staying adequately hydrated, giving ourselves enough nutrition, and finally, when we're recovering, we always want to keep an eye out for any potential complications or recurrence. So if we have worsening pain, worsening diet, we're unable to eat, we perhaps are having a fever, getting jaundice, we want to make sure we contact our healthcare professional right away, because this could be a finding of either recurrent pancreatitis or an associated complication. So the last question I wanted to get to is, what lifestyle changes can somebody make after a diagnosis of acute pancreatitis? Well, we talked about the recovery. We talked about what complications can happen and what to look out for. Of course, you want to ask your healthcare professional, but when we look at lifestyle changes we can make, number one is we want to maintain a healthy weight. Well, as I said, obesity is a risk factor for pancreatitis, and we want to get down to a nice healthy weight. Second is we want to have a healthy, balanced diet. We want to make sure that we're taking enough protein. So from lean sources like fish, poultry, beans, so that we can maintain muscle mass. I've said this time and time again, but I'll say it again. We want to make sure that we quit smoking or abstain from smoking. We want to get regular exercise. That's been shown to decrease stress. And as we talked about, stress is a risk factor for getting acute pancreatitis. And finally, if we have any comorbidities, we want to make sure those are optimized, and we can do that through education and regular follow-ups with our physician. Okay, so that was 10 questions on acute pancreatitis. We went through what it is. We talked about what causes it. We talked about different symptoms with the pancreatitis. We talked about how we diagnose it. We went through how we might be able to decrease our risk of getting acute pancreatitis. We talked about the treatment, the complications, and of course, how patients recover and lifestyle modifications we can make after a diagnosis of acute pancreatitis. If you have any questions, definitely leave them in the comments below. I love it when I get to engage with you guys, and make sure that you continue to educate yourself. There is nothing wrong with getting on the internet and getting more education. Take those questions to your doctor. They will love it. All right. So as always, stay safe, study hard, work hard in whatever you do. I'll see you next time.